Hi, everybody. It's Dr. Cary Yurkiw here. Welcome to today's webinar on posture. We want to talk about different postural tips and ways that you can improve your posture. And I'm a chiropractor in Kelowna, British Columbia, and that's in Canada. And I've been practicing for over 25 years and seen thousands of patients. And often the topic of posture comes up because people want to know how they can improve their posture. I think it applies to adults, but it also applies to teenagers, and so a wide range of different demographics. And so today I want to talk about posture, and I want to talk about tips that you can apply to improve your posture. So I'm just I have the screen up. If you're on YouTube or on our webinar, you'll see my screen. If you're on social media, you may not see this, but so what can you do to improve your posture? Well, number one, good posture is when your ear, shoulder, hip, and ankle line up from the side. And from the front, what we should see is balance right to left, both in the shoulders and the hips. We should see the head level. So if we see any deviation of that posture, that can lead to muscular strain where the muscles on one side have to contract and the other side they're being stretched. And then it leads to changes in the range of motion and the flexibility. And then long term, what it's going to lead to is degeneration or arthritis on one side, because it's kind of like the tires on your car. If you're driving and your car's out of alignment, over time one side's going to wear out faster than the other. So that's why posture is important. It helps our spine and our nervous system to function better because it gives more space and more room for the nerve flow and the circulation as well. So there's other benefits to it too. And 3 exercises for better posture. We're going to go over that today. And I'm going to talk about your workstation and ergonomics today as well. And then things like text neck, which often people have their head down looking at their phone, and that causes the neck to flatten out and for you to get that hump in the back of your neck where the neck meets the shoulder. So we don't want to see that. So the first slide I have here is this one where on the left we see the person slouching at their desk. And when you're slouching at your desk, the back is rounded, the back is off the backrest, and the head is looking down. This is a curved posture forward. And if your posture is curved forward, it's going to cause forward strain on the spine. This can compress or narrow the discs. And what it can do is eventually start to cause degenerative changes, arthritic changes in the front part of the spine. So we don't want to see this for a long period of time. Sometimes people have their workstation set up incorrectly, and maybe this goes on for years. And that's where we can get into some real trouble as far as degenerative long-term changes, chronic changes. So what we want to see is the next picture right here. We want to see the monitor elevated where the eyes are at the top of the monitor, top of the screen, and then the eyes can look down at the bottom of the screen from there. The back resting against the chair. The arms at about 100 to 110 degrees, so a slight open bend in the elbow. And the arms resting on the armrest comfortably, and then the hands on the desk with, sometimes people do need a bit of a mouse pad just for their wrists so they don't get carpal tunnel. So that's a good setup. The feet should be on the floor. There should be an open angle in the knee, about 110 degrees in the back part of the knee, and again in the ankle, about 110 degrees for the ankle. So you have these open angles that are stress relievers on these joints, and the feet should be flat on the ground. You should also consider getting a desk that elevates, goes up. And I advise people every half an hour to an hour, depending on their condition, to change their position. So stand up, work at the standing desk, and then sit down again. And by changing position, it helps the circulation and the blood flow so it doesn't get too compressed in a certain area. So, and it does help the joints too because it changes the joint angles. So standing at a standing desk with the same type of ergonomics in the upper body is very good. So this is a good standing posture. The next thing I wanted to go over is some yoga postures and exercises for your spine. So I like these three: the wide child, the dog, and the cat. I'll often tell people to do the wide child on its own and then alternate between the dog and the cat. And of course, you want to talk to your healthcare professional before you start any new exercises. But the wide child's a nice, relaxing posture. You can have your knees forward or your knees slightly out to the sides. And then just let your body go parallel to the floor and rest your back so that you get some of that roundness out of your back and start to straighten the back this way. I would hold this for 3 to 5 seconds when you first start, and then start to increase your duration to 5 to 10 seconds. And I would do this 3 to 5 times. And then you can alternate the dog and the cat, doing this where you're extending your back, lifting your head up, and then flexing the back and having your head down, and then alternate in a smooth transition between these two movements. You want to hold for just an extra second at the top and the bottom of these positions, and then do this 3 to 5 times to start, then 5 to 10 times, and I would say 2 to 3 sets is what you should do. And I would do it in the morning when you first wake up, just kind of get warmed up a little bit, and then start to get into these exercises. The next thing that I wanted to go over with you is called wall angels. And for wall angels, what you want to do is you want to have your body in this starting position with your back and head against the wall, your arms out on the sides, and then you want to move your arms up against the wall, keeping the head and the upper back against the wall and the hips too, and a slight bend in the knees. So the knees should be off the wall, the feet can be off the wall too. So just slide your arms up the wall until they're up overhead like this. If you have problems in your shoulders, you might want to do a modified version of this, but if you don't, you can extend your arms straight out right above your head and then slowly come back down to B and then to the A position here, the starting position, and then go back up to your arms overhead and then back down to this position. I would do this 5 to 10 times a day, and then do 2 to 3 sets of this. And this is going to help with your rotator cuffs. It's going to help with the upper back posture. It's going to train you to keep your head back against the wall, because too often people have their head forward and they're slouching like the text neck that we talked about earlier. Join me every weekend. We're going to have coffee with Dr. Cary this morning. It gives you a chance to ask questions during the week. You can PM me, and I'd be happy to answer your questions at Coffee with Dr. Cary. Also, you can be live on our chat. It's good to get a ticket to the event on our website. I'll put a link in the show notes, or you can go to the link in the bio and then go to events and get a free ticket for Coffee with Dr. Cary. That'll allow you to type in the chat. But also here on social media, we'll try to stream these on Facebook, on Instagram, and on Twitter. So feel free to type in the chat or comments on social media as well. So thanks for joining me today for this postural webinar. If you're interested in becoming a patient in the clinic, for a limited time, we have this special offer where you can click on this link, drcaryurkiw.com/15 off, and you can get $15 off your first visit. And usually we can see new patients within 48 hours. We do bill directly to insurance, including ICBC, and no doctor referrals needed. So very easy to book online, and you get $15 off if you do that. www.drcaryurkiw.com/15 off, and then you'll be able to get that special discount. If you're on our main page and you don't see this, then in the coupon code, just type in 15 off, and then we'll take $15 off when you come for that first visit. So thanks again for joining me today. I hope you learned something about posture, and I look forward to seeing you at the upcoming events this week.